in.
Hi, how are you?
Hi, I'm okay.
Do you go by Jen?
Yeah.
Hi Jen, nice to meet you.
Hi.
I'm Danielle. I'm the NP coming to assess you. It sounds like you had a bicycle accident today. A little banged up.
Yeah.
That's pretty scary.
Yeah, it was no fun.
Yeah. So we're gonna I'm just gonna do a little exam and assess you and see what order plan's gonna be post your bike accident.
Okay.
Okay,
Sure.
I'll wash my hands over here. Are you comfortable in the position you're in?
Yeah,
Okay.
I'm kind of sore.
Yeah,
Yeah.
that's to be expected. It sounds like it was pretty bad. I saw your bike helmet. It looks like it was pretty dented up, but I'm glad you had that on. Great. Thank you for being safe and proactive.
I try.
Good. So I looked at the photos that were in the chart of your left wrist area. It looks like that was pretty, there's a wound there and it's bandaged up, so we'll
Yeah,
keep
they
an
were.
eye on that.
Yeah.
How does that area feel right now?
It's pretty sore.
Yeah,
Yeah.
okay. Sore, is it throbbing? Is it just constant pain? Is it dull, sharp? Can you describe it for me a little bit?
It's pretty constant. I think throbbing, yes. Kind of goes up the arm a little bit, travels.
Okay. If you could rate it on a scale of 1 to 10, 1 being no pain, mild pain, to extreme pain being 10, where do you think you fall with that pain?
Probably like a 5.
Okay.
Yeah.
Okay.
Yeah.
So I think what we'll do we'll get an x-ray of your wrist. I want to make sure that wrist is not broken in any way, so we'll do that. And then I want to take a look at your head and do some neuro exam for you to make sure that you're neurologically intact, if that's okay.
Sure. Yeah.
Okay. So the first thing I'm going to do is I'm just going to look at your head. Looks like you have a little bit of bruising here on your left side where your helmet was dented. Can I touch on your head there to see?
That's okay.
Does that feel painful at all to you?
It's tender.
Okay.
Yeah.
Yeah, when I'm looking at you straight on, it looks a little bit asymmetrical there, that there's some swelling there on the head. I'm going to have you look right at my nose, and I'm going to use my pen light here to look at your pupils, okay?
Okay.
They look equal, round and reactive, that's good. Are you sensitive to that light at all? Is that painful
No,
for
that
you?
was okay.
Okay. Are you having any headache at all?
Yeah. Mild, I would say.
Okay.
Yeah.
Something that you've experienced before, maybe have you ever felt that kind of headache pain? Is that?
I mean, I've had headaches in the past, but this one I'm probably pretty sure because I hit my head when I fell and
Okay.
all that. Yeah.
Okay. And then I'm just gonna look straight on at you. If you want to, can you look straight on at me and stick out your tongue? Okay, good. Looks symmetrical, looks good. How about your vision? Are you feeling that your vision is clear? Can you clearly see me? Are you having any blurriness?
I think so. Yeah. No blurriness right now.
Okay, feels okay.
Mhm.
Okay. I'm gonna do a little motion over here, look straight ahead. And let me know when you can see my fingers here.
No.
Okay. And I'm gonna step over here. This side of you.
No.
Okay, good. So I'm thinking that what might have happened, that you're at risk for a concussion. I do want to get a CT scan just to make sure that there's no bleeding on the brain or any identifiable swelling that might be there, but I'm thinking that you probably might have suffered a little bit of a concussion here.
I had one before.
Okay, I thought I saw something like that in your history, so it looks like you've had a history of concussion, so that makes you a little bit higher risk for some of the things that can happen post-concussion, memory loss, difficulty concentrating, blurred vision. Is someone going to be home with you today? Who's going to be at home with you?
My spouse.
Okay,
Yeah.
okay. So what I want for you is when you discharge this evening, I want you to go home with your spouse and make sure that they know to kind of wake you up every hour, just to make sure that you're arousable, because should you not be arousable, you need to come back through the ER. If you have any nausea, vomiting, extreme vomiting, or your headache becomes significantly worse, you need to go back through the ED. If you notice that you're having increased drowsiness, or you're having difficulty concentrating over the next couple of days, somebody that has a history of concussion, you are at risk of having a longer recovery time post a second concussion. So over the next few days, just kind of monitoring and making sure that your symptoms aren't worsening. And if they are, we want to see you back in clinic.
Okay.
Okay. Do you have other questions for me?
I don't think so. The spouse knows this routine for the concussion. We had to do that last time, so.
Okay.
But just my wrist is really sore. My arm
Okay.
is sore, so.
Can I ask you another question? I just want to see,
Yeah.
while we're on the subject of your arm
Mhm.
again, can you wiggle your fingers for me on that hand? They all
Yeah.
move. Do you have sensation there?
Yeah, but it kind of is tender when
Okay.
it goes up when I do
Tenderness?
that.
Okay,
Yeah.
okay, okay. Yeah, I think we would need to double check, get that x-ray just to make sure that things are in the right place and nothing is out of place. Other questions for me?
No, I don't think so.
Okay. I'll make sure to document to confirm that concussion in your history in your medical chart, and then we'll get all of your discharge paperwork in order that'll have those instructions of how to monitor post-concussion for your spouse so that they know kind of what we're looking for with all the numbers on there.
Okay.
Okay?
Perfect.
Just gonna wash my hands. Step out.